This episode is brought to you by Intraprise Health, a health catalyst company. Make cybersecurity a priority, not a headache. Cyber attacks put patients at risk and cost healthcare organizations millions. But with convoluted software systems and risk and vulnerability data lost in silos, leaders know their organizations are vulnerable and they feel little control over the safety of their patients, reputations, or bottom line. Intraprise Health brings together cybersecurity experts with over 100 years of combined experience in healthcare to offer a comprehensive suite of innovative software and services. It helps leaders finally unlock a unified human-centric cybersecurity approach. With Intraprise Health, you can improve your cybersecurity posture, protect your patients, and simplify your employees' lives. Visit thisweekhealth.com/enterprise-health to find out more.
Today on UnHack the News.
It's easier to deal with the problems you understand than the problems you don't understand or you have a hard time with. And at least you're doing something useful. But ultimately, the next generation of products are going to have to allow people to put these things together.
Hi, I'm Drex, a recovering healthcare CIO and longtime cyber advisor and strategist for some of the world's most innovative cybersecurity companies. Now I'm president of This Week Health's 229 Cyber and Risk community. And this is UnHack the News, a mostly plain English, mostly non-technical show covering the latest and most important security news stories. And now, this episode of UnHack the News. Hey everyone, welcome to UnHack the News. I'm Drex, and that guy over there is George Pappas from Intraprise Health, a health catalyst company. I still struggle with that a little bit, George. How you doing?
Good. I'm doing great. Good to see you again.
Good. We haven't been on for a while. We haven't done this for a while. I always have a good time when we're running through the news, and we got a lot of interesting stuff to talk about today.
Exactly.
So I'm going to start with something that's going to back into something that you sent me. I wrote an article this week, and it was on North Korean catfish. It's published. It's part of the 2-Minute Drill Extra on LinkedIn, and it's about North Korean fake employees and what you can do to not get catfished. And it's gotten a great reaction, like kind of blows me away sometimes when every once in a while something like really hits. And one of the things that you sent me as we should talk about this is from the H-ISAC, and it's a TLP white document. Anyone can get access to it. It's called Artificial Intelligence and Digital Identity, a CISO's Guide to Implementing Advanced Technologies to Fight Cyber Attacks and Fraud. And in there, they talk about the North Korean catfish problem. They don't call it that, but the same issue. What were you thinking about that as you went through it and read it?
Yeah, there were a lot of parts of that article the paper, I should say, that I appreciated. I think at a top level, what they were really trying to do was to urge CISOs to do things in very targeted fashions, which I think, given the general state of AI, makes a lot of sense. We'll get to that as part of this. I know.
Yeah.
And they also were not just in identities, but you think about everything that revolves around the identity. Email phishing, right? Access to facilities, access to systems. We've spent a lot of time doing various forms of white hat, black hat penetration tests, impersonating people and seeing how far we do that kind of work and other things. And what struck me about the article was that you think about vulnerability management, which means how can you figure out among the 10,000 things what's important,
Right.
How can you make a fish that is going to be impactful, and are there a group of people that keep not paying attention, and what should you do about them? And all these questions, and AI used at a narrowly focused functional level has a lot of acceleration capability, right? I mean, as I was reading about the email one too, it really kind of hit me that you look at the header of an email packet, you look at what goes into the email name of the sender. Those are all things we kind of look at manually. Well, it's really good at doing those kinds of things, right?
AI looking at those things.
Yes.
And saying, no, that's not really that's a 0, or they've camped out on a fake domain. Yeah.
But then getting back to identity, I mean, this brought back from my time at Dr. First, identity proofing as an idea, because as we were really the first company back then to do electronic controlled substance prescribing,
Right.
the DEA was rightfully very concerned about that. And so there was a whole system of identity proofing that was established. So we knew that Dr. Smith was actually Dr. Smith. And that is carried forward in today, and how large EHRs, large health systems, small medical practices manage identity. But I think as that H-ISAC paper called out, this gets back to the catfish issue. We're all remote now. So there's more kind of opportunity for mischief. And I think it calls for this kind of, I'll call it identity proofing for the AI age. You can do more discrete things. Because I even remember as we were rolling out New York State, they were the first state in the country to have required electronic prescribing, 2016. I lived through it with our team back then. And it used to have a person, well, there was a thing called a credentialing service provider. That was like an old credit bureau. You had to ask them, well, that's the stone tablets age. Let's use some intelligence to really make sure that person is who they say they are. Have some kind of warning flares that pop up. Do some non-electronic verification steps. And let's also scale that based on the impact and severity and sensitive nature of the job we're hiring for. How about that? Right. So,
Yeah. A lot of this, the phrase zero trust is overused maybe, but
right.
this idea of looking at the applicant and then going through a whole series of things you want to look about that resume. What about their social profile
Right.
online? All these kinds of things. And maybe those things generate a score that if you're not above this score,
Right.
there's something fishy about this applicant. And it requires a little more research or extra steps that you
Correct.
don't normally take with other applicants.
Correct.
So things like that, maybe?
Exactly. And that's what, think about credit card issuers. If you're buying a hat in Guadalajara 1 minute and then buying at a bar in Prague the next, well, maybe there's an issue there, right?
I just got a notification on a credit
did?
card, and the notification was, hey, you just bought a game for an Xbox online. That doesn't seem like a thing
Right.
that you normally do. Was that you? And I was like, no, that actually wasn't. So yeah, it's using
A lot of
AI
leverage
for
there.
things like that to,
And I think in the other aspect of that document, what I really appreciated was they applied that same bounded problem, narrowly focused, so you get high reliability out of using AI in the state it is today to go address these kinds of problems. And it's a way to firm up the infrastructure and take things that today are done with less precision and do them at higher precision at scale. So it made a lot of sense.
yeah. Here's yet another thing about AI. We're sort of now sort of branched generally into AI, but one of the things I think I see happening with AI is that sometimes we do things today and we don't really do it well,
Right.
but we do it. Or sometimes there are things we're supposed to do and we don't do it. And then the idea is we implement AI, and because AI isn't perfect and leaves gaps, we're like hypercritical of the AI, more hypercritical than we were about the broken process that we were
Right.
using originally. And I feel like there's an unfair standard of those kinds of things that happen sometimes with artificial intelligence today, or generative AI in some cases today. Do you
I
see
agree.
the same thing?
I agree. And I think some of that is we're seeing this thing that's competing with us, maybe.
I didn't really think about it like
Right.
that.
I also don't make super high level of precision the enemy of better precision, better economic result, and better leverage for the task you're trying to complete.
As we say, perfect is the enemy of good. The thing is, too, once you start using AI and you continue to use it and train it, it is
Wow.
the employee that just can keep getting better and better, too.
Yeah. And that paper that came out, it's not part of that article around these steps for safeguarding AI. In NSA, AHA, John Riggy and the team there sent it out. If you read that document, and I did, what you're really seeing is NIST has a lot of these things where it says, do this. Doesn't quite say how. Doesn't quite say what's it going to take to do it, how expensive it will be. Do you even have the capability to do it? But those sets of standards that are sort of being laid out, I think are important. But how are we going to do all that? And who's going to have the burden of doing that? I think this is where it's going to take what we've been living in, Drex, for a while about third-party risk, bring it to a whole new level. It has to be contended with a little more precision. It's a very complicated problem because even in that document, it was sort of like we were using the techniques that we have today to describe something we don't yet know how to really measure at that level of broader, more general use.
I'm going to wrap this one up and move into the next
Okay,
article.
sorry.
But I mean, I think some of this is just like, congrats to H-ISAC. If you're not a member of H-ISAC,
Yeah,
you probably
great
should be
organization.
in your health system. They have a bunch of these TLP white papers that are available, and it's good. These are great references and great conversation pieces with your staff. So go out and take a look. This one was published just recently. And again, it's artificial intelligence and digital identity, and a great read and a lot of good insights there too. I wanted to ask you about this other article because you just mentioned third-party risk. And the University of Chicago says it's ended its relationship with Nationwide Recovery Services because of a breach that they've had there. Give me your thoughts on that.
I almost fell out of my chair when I was reading that one.
Uh-huh.
I was like, wait a minute. They're letting people know this now when it happened 12 months ago. And when you see a firm, Nationwide Recovery Services, it's likely a collection agency with a name like that, which is not that big of a deal. But then in their message, the fact that they were so imprecise with what they were able to say tells you that, does anybody really know what happened? Did anybody really share what really happened? And kind of the problem I have with that, why I really fell out of my chair, was the level of opacity around this whole thing is massive. And if you're somebody whose data may have been compromised, or they have no reason to believe anybody's data was compromised, you're thinking, well, what does this mean? How should I gauge this new risk to my identity or my personal information? And there was nothing there. So the whole thing, to me, I hate to use this phrase, it was like it was lawyered up without really being of help to the people whose data was compromised.
This is definitely a thing that we see all the time. It's like there's breaking news, somebody's been breached, here's what happened.
Right.
We always get, I feel like, not necessarily in this case, but kind of in all cases, we get the general, some data may have been taken. We're not sure how much. So far, we have no evidence that any of that data has been misused, and we'll be in touch. The thing is, I probably shouldn't, but I will, speaking for health systems across the country, that lack of information is really maddening.
Yes.
Because there's a lot of details about that breach that if I knew them, I could probably go better protect myself. But because I think lawyers probably get involved, cyber liability insurance companies are called, who immediately kind of put the clamps on everything.
Right. Bringing in the team, clean the area, right?
Nobody can say anything. I mean, the yellow tape goes up, or the virtual version of the yellow tape goes up, and nobody can see what happens behind that. And maybe if we're lucky, somebody tells us about what's going on after the fact, but that's when my Signal chats all go crazy, because there's a ton of speculation. A lot of people are maybe making things up.
Right.
Because in that information gap, as in the rest of our life, when there's no information, when you're not transparent, people just do make things up.
Correct.
Because they start to speculate. And that speculation can actually cause us to waste time and energy working on things that aren't really the right things to be working on.
Agreed. And the fact that this happened that long ago, I don't know how much time they actually waited until they were informed by this collections agency and then notified it. But as I read the total lack of actionable information, I thought, how little regard for the people that are the ones that could be affected by this.
It makes
that, to me,
wonder,
it really came out.
So I know that you guys work on a lot of this kind of stuff too.
Yeah.
Contract language that you have with third-party partners and things that you say in those contracts, like from the time you first suspect a breach until the time that you contact us and tell us that perhaps there's something going on, that time can be no longer than X.
Correct.
You don't have that language in your contract. I mean, you kind of open yourself up and you create a situation where there's no way ultimately of trying to hold, if you have to legally hold the third party accountable for that.
Well, and the other part to this, Drex, if you read that language, you don't know if it was because a staffer left, they didn't basically deprovision their credentials. They didn't really say anything.
You don't know.
All they said was unauthorized access, but we have no evidence that your data has been exfiltrated or shared. So, I mean, that to me was the part that's like, well, so what does this really mean and what should we do? And there's really no assistance at all.
A friend of mine, I think who we probably both know, but I won't name the person, told me about a business email compromise situation that they had a few years ago. And what happened in that situation was that what was being sent internal to the company were reports that had lots of information about patients and lab results and other things. And so when their email was compromised, And because necessarily the logging capability wasn't there, they had no way to know what was and wasn't viewed by the
Right.
bad guys. And in fact, had maybe kind of a hard time saying, like, I don't know if they actually took something out of email or what did they see? And then what did they download? And so they had to assume that everything that they had in email, which as in a lot of health systems is years worth of archiving that winds up being in email, they have to assume that it's all been breached and they have to report it that way, sometimes even when nothing happens. Again, a ton of work and a ton of those letters that have to be sent out and more credit monitoring for everybody when in fact, maybe that wasn't really necessary.
Correct.
We see that same stuff all the time too.
Yeah, all the time.
Okay, let me go to the last story. This one's kind of interesting too, because it sort of plays off of this one. There was a survey done by Splunk, and it said of 2,058 security leaders, it finds that nearly half the respondents are spending more time maintaining tools than they do defending their organizations from actual cyber attacks, which I take as the bottom line being too many tools that are very complicated and hard to manage, and they take a lot of time to be babysat and updated and make sure all of the whatever, if you're trying to get tools talk to each other, make the APIs work and all that kind of stuff. Did you take away the same thing? Or I feel like in our little preliminary discussion, you might even have taken more away than that.
Yeah, I did, but I started where you were in that it's a natural instinct to protect what you need to protect by buying things, the best point solutions you can to endpoint detection. Yeah, you SOC SIM data, fill in the blanks. But what does it all mean? And does it mean that you're doing enough? Are there gaps that you're missing? And part of what I read into that article was that a lot of very hardworking people are using these tools to do various parts of this, but they're kind of dispirited because they don't feel like they're getting support from leadership. That was called out once or twice in that survey and that paper. And you have to wonder, is it because they're not able to explain what it all means and why they need more help and show it in some comprehensive fashion versus, hey, I got, 2 less vulnerabilities on this thing today. Well, how do you relate that to the big picture, right? And your assessment and your technical debt and all those other things that a CISO has to do and a CIO has to be a part of. And so and I'll get on my little psychology hat for a second, think that maybe some of this is, it's easier to deal with the problems you understand than the problems you don't understand or you have a hard time with. And at least you're doing something useful. But ultimately, the next generation of products are going to have to allow people to put these things together and come up with a way to understand. And one other thing I do want to say about this, you hear this in every kind of facet of technology acquisition and ownership by organizations, not just hospitals. They don't want 500 vendors. They want 20. They want 50. So I think that's why you see some of the biggest names in the business broadening their platforms to make it easier for an organization to make that choice, which is understandable.
Sure.
One throat to choke, or at least 5 or 2, with enough areas that are around the things you have to really make sure are getting done properly. So I think that's also what this is speaking to. They always, in this day and age, AI is sprinkled around as a solution to everything. Now, I do think clearly with a lot of the machine readable data at volume, there's lots of ways it can do a job that someone's doing today at scale, better, highlight things that need human intervention. So I'm not discounting that at all. I think that will happen. But the bigger picture is, and there was another survey I saw, I can't remember where it was, that said the average, and it wasn't even with hospitals, has like 25 different tools. So
I've seen those numbers even be higher in some of the surveys that I've seen, like 35 or 40 and something.
That's kind of the issue with it all.
I think the other part of it too, I mean, the world changes over time. The threat changes, changes. A lot of folks like what they have and what they do, and that's what they've done for the last 5 years. And so that's what good looks like. We run it like this. We hire these people to do these things. We're built in, as you kind of refer to, silos of excellence, right? Different areas and different things that people on my team are doing, and they do them really well. There's hardly any Venn diagram how those things are connected when it comes to overall defending the organization. I think the other part of this too is how do you translate all of that, as you sort of alluded to? How do you translate all that into clinical and business speak? And even people who are on your board who don't have anything to do with clinical or business operations in healthcare, how do you help them understand? A lot of that's the risk conversation, and that is still a very difficult space for a lot of cybersecurity professionals who talk a lot about risk, but don't have a great way of sort of translating that into business and clinical and board speak. How do you coach people on that, or how do you advise people around that risk conversation?
It really is trying to get an integrated view, however we do it, with some of our tools, or just getting the client to normalize the things that they're coping with and putting them into some kind of framework, because the frameworks are out there, and then bringing that all together along with the other organizational choices that have been made, and finding a way to present that in a business language to the board or the audit committee. That's who we normally present with, our CISO or CIO client who we're representing, to help them understand the picture. And we bring in benchmark data, because people want to know, well, gee, we're a 800-bed hospital. Are we spending more or less than others? Well, what does that mean? Right. And so you need kind of who else like us is doing something like this that helps get the point across.
Yeah.
But it takes a little longer time, but the more you can truly bring it together and clarify it, and that's the work we do with our platform, the more understanding you're going to engender among the directors who have to make these choices, because dollars are tough to come by. You're asking them to spend more money. And so they want to know that you understand where it's going to go, not just that you're going to provide them with the resource.
You're building a business plan
Right.
against risk. And that is the conversation that you're having. And that risk changes all the time.
Correct.
Group practices or decide to build a surgery center or whatever the case may be. The market changes. The bad guys have new capabilities. The North Koreans start trying to catfish you. All those are new risks, and you have to constantly be sort of creating this nonstop performance improvement business plan against those risks. And you have to be able to explain that. Otherwise, the resources fail, and ultimately the business can fail because of that.
Correct.
Yeah.
Correct.
Hey, thanks for being on today. I always feel like we could spend a couple hours doing this.
Same here. I love the show. Love the way we do it. So appreciate being here.
Yeah, thanks. All right. Talk to you soon.
All right. Take care.
Thanks for tuning in to UnHack the News. And while this show keeps you updated on the biggest stories, we also try to provide some context and even opinions on the latest developments. And now there's another way for you to stay ahead. Subscribe to our daily insights email. What you'll get is expertly curated health IT news straight to your inbox, ensuring you never miss a beat. Sign up at thisweekhealth.com/news. I'm your host, Drex DeFord. Thanks for spending some time with me today. And that's it for UnHack the News. As always, stay a little paranoid, and I'll see you around campus.